Being here today. You are an expert. You are nonpartisan. That's something rare in Washington these days. It means that neither side likes you and both appreciate the work that you and your staff do because it's really important. The budget is our ultimate policy document. It's a moral document. And it's so much more than spreadsheets and esoteric terms because it shows up for people in our communities in ways that they can see and they can feel. It shows up in their monthly bills. It shows up in their health care, their child care. It shows up in their insurance rates. It shows up in rent and mortgage and the cost of groceries and food and how much food is even in the pantry and their kids' opportunities in education. The things we do in this budget, they show up and people see and feel them. And I think that's particularly true right now. Everywhere I go in Louisville, Kentucky, people are talking to me about these budgetary policies and the ways that they impact them. In fact, just this weekend, I was out in Louisville and I got stopped by a couple who own a small business and they said, "We've been listening to you. If you need one more story about the cost of healthcare, here's ours." And they own a great business in my town. And together, the two of them are on the Affordable Care Act. They pay $625 per month. So it's not free, $625 per month. Without the Affordable Care Act tax credits, they told me that their premiums are going to go to $2,501 per month for the two of them to have health care. They run a great small business, but no small business owner can afford to do that. So as we're talking about these ACA tax credits, Dr. Swagel, if we don't extend the ACA tax credits, our out-of-pocket costs for families that rely on them, like the small business owners and entrepreneurs in Louisville, Kentucky, going to increase significantly?
Yes, the out-of-pocket costs will increase with the end of the subsidies. The impact will depend on people's age, people's income, and there's some groups that will have quite large changes in out-of-pocket costs, and others will have more modest ones.
But what I'm hearing is it's going to impact everybody, and this isn't going to just show up in what they pay out of pocket. I'm worried this shows up in how people actually get healthcare, how they take their kids to the doctor when they're sick, how they go to the doctor when something's wrong. If these ACA tax credits aren't extended, how many people does the CBO estimate will lose their health insurance altogether?
That we have the change in the uninsured at around 4 million with the expiration of the ACA enhanced premium tax credit.
4 million people are going to lose their health insurance. And why do you think that is?
It's, some people will lose access to the subsidy entirely. Some of them might have a subsidized offer of health insurance from somewhere else, but the subsidy might not be enough for them to take it up.
And I know you're a budget guy and you're using big budget words,
Yeah.
but that means people aren't going to be able to afford it.
It's a mix. The cost will go up and people will say, I can't afford that. Yeah. And then they'll be uninsured.
Right. That's what's going to happen. So how many total, because now we're talking about the ACA tax credits. Those expire December 31st of this year. But in previous legislation this year that some have referred to as the one big beautiful bill, I don't think it is that. But there's other Medicaid cuts in there that are really going to impact my state in Kentucky. The Kentucky Hospital Association is predicting 35 rural hospitals are going to close. Hundreds of thousands of my neighbors in Kentucky are going to lose their health insurance. How many total do you all think will lose health insurance? If you combine the Affordable Care Act tax credits not being extended by the Republicans, and if you combine the other changes that have been made, such as in that bill, what's going to happen?
Okay, right. So we just talked about the expiration of the premium tax credit, the enhanced PTCs. Within the 2025 reconciliation bill, the changes to Medicaid, we projected that would increase the number of uninsured by 7.8 million. So that's from the Medicaid side. There are changes on the Affordable Care Act side that would increase uninsured by about 2.1 million. So those two together come to about 10 million from the 25 Reconciliation Act.
That's 10 million Americans are going to lose their health insurance. Are those Americans going to stop getting sick?
No, they won't.
Okay, right, and it's going to cost all of us more money. This is why this is so important for us to deal with, and why it's so important to deal with right now. Because you know what, people don't care about this committee. They don't care about the pieces of paper that come out. They care about being able to take their families to the doctor when they get sick, and that's what we should be helping to do up here. Unfortunately, I'm running out of time. I am extremely worried about the cost going up in food because of policies. We'll get with you on some of that, and especially with the income distribution, how so much more is going to the richest Americans, and it's not being spread across the field right now at a time, again, when there are policies that are they're causing people to lose their health insurance. So thank you very much, Dr. Swagel, for being here. Mr. Chairman, I yield back.
I thank the gentleman, and again, remind my colleagues, we will have a healthcare debate and discussion and a good hearing, and it will be in the immediate future, and I'm looking forward to that. Now,